conduct a series of lectures that will surely benefit us in our practice through the latest updates about COVID-19. Last Sunday, September 20, 7 a.m., we started with the Thanksgiving Mass for us doctors, our families, frontliners, including our members that passed. The Mass celebrated at the Centennial Church of St. Joseph Parish. The next activity was the exhausting, fast-paced Zumba. Ha, ha, ha. Yung warm-up at cool-down, parang pareho lang, but enjoy lahat. Aminin, yung mga sumakit ang likod at paa na katulad ko. I hardly can keep up with Jerwin. It's probably his counting. Instead of the 1, 2, 3, 4, 5, 6, 7, 8, he was like 1, 2, 1, 2, 1, 2. Or it must be me. September 21, 10 a.m., we had a lecture by Dr. Rona Bergantin, Ako Laban sa COVID. We had a good 306 views at Zoom and FB. At 6 p.m., a lecture about superbiotic. Can superbiotic help flatten the curve and quiet the storm? As lectured by Dr. John Ignatius Ledesma. Pang-superheroes, binagaya ng ating PAM Night, Heroized PPE, na siguradong pinapaghandaan na nating lahat. This morning, September 22, another lecture entitled COVID and the Planet. Disinfection, sterilization, use, and reuse of PPE and the proper waste disposal, given by Dr. Anne Gabrielle Chan. We have 149 attendees. You had us worried, nakakalog-kalog ang attendance. So please register ahead instead of the last-minute registration. Thank you. Another interesting lecture awaits us tonight. What's in store for us in the future? Please, Professor, break it to us gently. The future of healthcare, reimagining the customer and the digital transformation of health and wellness delivery. A warm welcome and thank you, Professor Richard, for accepting our invitation. Let us all learn together and heal as one. Marami pong salamat.
Thank you, Dr. Calapatia. So let me just, total, sinimula na ni Dr. ng teaser. Can I just share my screen for the teaser for this year's PAM Night? Okay, so since my boss was Optimus Prime, I have to be Bumblebee. Yan, ako naman po si Bumblebee, encouraging the members, auxiliaries, and the med reps to join. Just send your entries, heroize your PPE. Until tomorrow, we can accept entries, and then that they will be judged on the PAM Night. So thank you, tama na to, okay na yan. Now let's get formal. So just a few house rules. Again, all participants are requested to stay muted during the duration of the webinar. If connectivity problems are encountered, just disconnect and join again. You may type your questions and comments at any time in the chat box, and they will be answered during the open forum after the lecture. So this is a nitpicking of the brains of what is the future for medicine. So I will introduce our moderator for tonight's activity. She is a graduate of Pamantasan ng Lungsod ng Maynila, 2001 Medicine, and had their postgraduate course in Occupational Health and Safety in the College of Public Health in UP Manila, graduated 2005. She is currently a medical officer 4 at the Public Health and Safety Department of SBMA and recently awarded as PMA's Most Outstanding Physician for Olongapo City Medical Society. We know her all well as Tetet. May we call on Dr. Maria Asean Briones del Mendo.
Good evening, friends and colleagues. Have you ever wondered how patients will access healthcare in 2021 and the next 5 or 10 years from now? And how we as doctors can keep up with the inevitable and fast-paced advancement in technology of healthcare delivery and scientific breakthroughs? If there is one good thing this pandemic taught us, it's the realization that we need to change our mindset and reevaluate our healthcare delivery system. The new generation of patients are more connected and comfortable with information gathering and online platforms. In the past, patients went primarily where their physicians told them to go, but now patients are looking for more flexible options like telemedicine, electronic prescriptions, and diagnostic mobile apps and softwares. As this trend continues to grow, health systems will need to invest in elements of choice, and we all need to adapt to this coming boom in system integration and evolution. We have to plan for a different skill set to cope with the changing times. And in order to understand what's at the heart of trends in healthcare, it is important to hear directly from an expert working in the industry of making healthcare design solutions to answer present and future challenges of our ever-changing world. We are truly fortunate to have with us tonight a seasoned public speaker with a lifelong learning and a strong sense of empathy and mission. Our speaker for this evening is an educator and innovator. He earned his master's in business management with distinction at Asian Institute of Management in 1997. He is an associate professor at AIM from 1997 up to present, and he is the head of the School of Executive Education at the same institution from 2016 to 2018. He is a management consultant of several public, private, and NGOs, telecom, energy, real estate, to name a few. To talk about the future of healthcare, reimagining the customer journey using business model innovation and design thinking, let's all welcome and listen with open hearts and minds to Professor Richard Anthony Cruz.
Thank you so much. Thank you. Thank you to the Olongapo City Medical Society for inviting me. It's a very big honor. I am here at your service. I want to spend maybe 2 hours with you to be an enabler of new knowledge, to answer all of your questions, to bridge whatever gaps you might find, hopefully to inspire you. If I can just say that before the pandemic, there were 3 parts of society that were not so much affected by the digital transformation. The 3 parts of society that were kind of immune from digital transformation was government, education, and healthcare. I guess it's because when the government official says that they don't want to digitally transform, nobody can force them. Or when a teacher in a school says, or when a professor in a university says, I don't want to adopt digital technology, nobody can force them. Or maybe when a doctor says that I don't want to adopt digital technology, nobody can force them. But it seems like the pandemic has toppled 2 out of the 3 last bastions of digital transformation. I think both government and the education sector in particular have already yielded their traditional ways. And especially in the case of education, in my space, we have been completely pushed into the digital space. Okay. For the most part, most schools no longer meet physically nor face to face. So I can tell you firsthand experience since March, we've been running classes at the Institute completely online after 20 plus years of teaching in the case room. I personally thought that, um, I didn't have to do so well online because I thought it was only going to take a few weeks and then we were going to go back to normal back in the case room. But after a while, I realized that the disruption was so massive and the push of all of the students and teachers into the digital space probably means that we're never going to go back to the old ways of learning and school, high school, K-12, university, etc. Okay. So I was asked by somebody who was coaching me earlier this year, what was the biggest limiting idea that I might have about my own personal development? And I realized that the biggest limiting idea that I had at the time was that things were going to go back to the old ways. And when he told me that it's probably not the case, I made a new commitment to myself and to my students. And I said that um, I will try to become an even more influential, persuasive, and effective teacher on this platform than I ever was in the analog case rooms of AIM. Okay. So today I stand here with the society, uh, quite optimistic about the future, knowing that um, really at some point, it's just us really who's limiting our full potential. And if we can come to terms with our own identity and our own future, then perhaps new options can emerge. So I'm here with you tonight to maybe tell a few stories about what's happening in the innovation space, especially around healthcare, and maybe to explain some of the tools that we use. So I teach, part of what I teach at AIM is innovation management. And we use tools like customer journey mapping and design thinking and business model innovation. I've worked with many different incubators over the years, most notably Idea Space. We've been working with Idea Space for more than, I think, 6 or 7 years already. So we've had our fair share of exposure to most of the startups in the Philippines. And I do believe actually that as the years go by, more and more startups in the healthcare sector are emerging. And I just wanted to share with you maybe a little bit of what's happening worldwide and how also patients' behaviors are changing. So I prepared a presentation for you. I expect to maybe walk through this presentation for about maybe an hour or so, and then we can have a lot of Q&A after. Okay, so I'm looking forward to having an interaction with all of you. Since we're mostly on the Zoom platform, hopefully that maybe some of the doctors can also maybe verbalize their own questions later if there's a chance. If not, maybe you can just type the questions as instructed in the chat. Okay, so let's talk about the future of healthcare. And the title of this presentation is Reimagining the Customer Journey. And let me just say that this is a very common title that we use when we do presentations to different sectors. And what it tries to say to the audience is that ultimately, the whole purpose of this presentation and the whole purpose of doing business model innovation and design thinking is so that the patient's journey can become a better journey. Okay, so we want to be patient centric. And we're doing all of this to improve the journey of the patients, but also to improve the journey of the people delivering the care and the service. Okay, so I know for a fact that the amount of sacrifice and the amount of risk that all healthcare practitioners have taken over the past several months is quite tremendous. And it's clear that there's also a great need to improve the safety and security of all healthcare workers as part of the journey of all patients. Okay. So the question really is, how can we reimagine this? Okay. So I'm a professor at AIM, and AIM as an organization is a nonprofit educational institution. We are heavily and deeply involved in the transformation of different industries and sectors of society. Today, I'm heavily involved working with many sectors, including agriculture, fintech, retail, etc. There's so many industries right now that are in desperate need of support, coaching, mentoring, guidance. Just this morning, I was with the Philippine Travel and Tourism Exchange conference that's going on, sponsored by the Department of Tourism. So there's a lot of work right now, actually. A lot of leaders and a lot of presidents, CEOs of different organizations, this last quarter of the year, spending a lot of time trying to figure out what's in store for the future. Okay, so I have some quick objectives here. So I just wanted to initiate a conversation with the participants so that the society and the individuals can maybe consider their directions and strategies moving forward. Gain an overview of digital medical startups today, and maybe a little overview of the concepts of customer journey, design thinking, and business model canvas. Okay, so all innovation starts with understanding this notion of the gap. Okay, the gap between what is and what can be or what should be. Okay, so I have been trained my whole life to spot the gap in everything I do. So I walk down the street and I'm looking at every single person that I'm walking by or walking next to, and constantly I'm trying to observe what's happening in the environment and trying to understand what is actually happening, the what is, and is that what should be happening or is that what can happen? Okay. And all designers, all innovators thrive or exist to close that gap. Okay. So let's take an example of a gap. Okay. So I have here a patient journey. This is a new survey. This was done in the United States, about 1,600 respondents. And this is the patient journey in terms of how they discover healthcare service providers. How do they consider? How do they select? And how do they become loyal? Okay, so I'm going to talk about this information a little bit. I thought it might be of interest to all of you. So in discovery, the first item here says consumers rely on online resources 2 times more than they do word of mouth referral. Okay. And half of all patients use third-party websites to find providers. So when we say third-party website, it means not your website nor your hospital's website. Okay, they use a third-party website in the US. Okay, and then with consideration, they will read reviews about the provider even after they've been referred. And 56% of all patients consult 3 different online sources when researching a doctor. Okay. And then in selection, before making an appointment, patients say doctors' ratings are the #1 factor influencing their decision. And 60% want to make an appointment digitally, online, or mobile app. Okay. And when it comes to care delivery and experience and loyalty, it says here, quality customer service is still #1 factor driving patient loyalty. And 60% of patients say ease of appointment booking is key to a 5-star review. So it's not good enough that you provided good service. It's also important that you made it easy for them to access that service. Okay. And the leakage here at the bottom, it says nearly half of all patients would decide not to book an appointment again with a provider who had incomplete listing information online. Okay. So remember, this is a survey that was done early this year in January 2020, pre-pandemic. Okay, this was before the pandemic, but it's 2020 data. Okay, so let's look at more data about the patient journey. So 61% of patients rely on online resources versus word of mouth referrals. Okay. Word of mouth referrals, only 30% relied on that. So there's 2 times more people who rely on online resource. Okay. And the decline in usage of provider referrals, so this is the referrals from the insurance companies, is down by 44%. Okay. Around 90% will go online to read reviews about a referred provider. 70% drop in usage of insurance referrals. Referrals were outranked by ratings. Okay, so notice the one in the lower left. No? Referrals is just the second most important source in 2020. The most important source or influencer deciding which provider is ratings found on a third-party website. Okay. And 30% increase in online search usage since 2018. Okay, so I'm presenting this to you. I'm sure this is not exactly what's happening yet in the Philippines, but I'm guessing that this is already a sign that it's going to happen in the near future? Okay. So here's another survey question. When choosing a new primary care provider, I most often rely on 38% say online search, healthcare directory, or review site. 22% said insurance website. And then 5%, 36%, 30.6% said referral from acquaintance or existing healthcare provider. And then the rest are scattered. Social media, referral from benefits manager, etc. Okay, but the big three are online search, referral from friends or acquaintance or existing healthcare provider, and then insurance website. Okay, so I think the big news here is that the 38 is now actually a more important source than referrals again. Okay, and I have two more slides on this survey. Select all the resources you've used in your online search for a healthcare provider. 82% said they use search engine to find the doctor. What I did not include here is what did they type in the search engine. So they don't, most of the people type the specialty of the doctor, not the disease. Okay. So they will type something like ophthalmologist near me. Okay. Or pediatrician near me. That's the number one search term for doctors. Okay. So if you want to find out whether you will come out or not, you can go and get your phone right now and you can type your specialty and type it in and search your specialty near me and then see what comes out in the search result. Okay. In the US, that's already 82.8%. Okay. Followed by insurance website and then review or content website. Okay. So healthcare review site, non-healthcare review site, or content website. Okay. I'm sure in the Philippines, there are already some blogs or some communities that already review some doctors. So I'm guessing, for example, like mothers' websites might be talking about pediatricians already. They might be making some kind of online review based on their experience with their pediatricians and so on and so forth. So I'm sure that's already happening in the Philippines. And then the last one here is health system or hospital website. Okay, 41%. So the tip here in the bottom for everybody is it's becoming clear, critical that providers and healthcare organizations establish and maintain a healthy presence on multiple trusted third-party review and content websites. Okay. So kasama dito, I guess the one that's relevant to the Philippines is Google. Okay. So technically what it's saying is it's becoming increasingly critical for all doctors to be searchable on Google. Okay, and then when you link it to whichever link, that it looks like a reputable review of the doctor. Okay. And then finally, from the survey, 2/3 of all patients who search online read reviews. And the number one driver is really the quality of the review, more than how the doctor's rating is or the recency, etc. Okay. So we're really entering into this world where, and I'm sure that this is a very unfamiliar area where doctors are actually going to be reviewed on a public forum online. Okay. Okay. And then here are some of the most common challenges in finding a healthcare provider. It's too time consuming and there's not enough information available for me to make the right decision. Okay. So here are the other problems. Okay, so basically this survey is just an example of data that was collected to describe what's the customer journey when it comes to finding a healthcare provider. Okay, and I was saying earlier that in all customer journeys, no, so in every single customer journey, regardless of industry, whether it's healthcare or education, everything, okay, there's always going to be a gap. There's always going to be a gap. Meaning there's always going to be a gap between what is the actual experience versus what it should be or what it can be. Okay. So this is not meant to be a criticism. This is just the truth. This is just the reality that in our life experience, there's always somebody or something that wants more out of that experience. Okay. So the question really is, do we or how do we assess our ability to improve healthcare experiences and outcomes? Okay. So I don't know whether there's some kind of tracking system being done within the city. I don't know whether there's a lot of data that talks about or compares different healthcare experiences within the city or the province. And I don't know whether people are aware of the healthcare outcomes of different service providers. Okay. So I'm sure that that data exists, but maybe it's not just organized, nor is it accessible via app or online or search. Okay. But I think what's going to happen in the future is that all of these experiences and outcomes and data and tables and metrics will eventually become more and more transparent online. Okay. So the big challenge though really is, when we talk about the sustainability of our whole country and the productivity of our workforce, and then given the young demographics of our country, the question really is, given the young demographics, are we able to close those gaps fast enough so that we can achieve all of the targets, especially those outlined by the SDGs? Okay. So personally, and of course, AIM in general, we're really involved in supporting organizations, especially those that are aligned with achieving SDGs across different objectives, across different goals. Okay. Okay. So let's talk about healthcare delivery a bit, and I want to talk about it in the context of different kinds of problems. Okay. So let's say medyo mahirap maghanap ng doktor o medyo mahirap isipin or intindihin kung sino ba dapat yung piliin kong doktor, kung aling ospital bang dapat kong puntahan. And then when I get there, of course, when I go through the journey, there's a lot of pain points during that journey. There are a lot of issues. So, when you talk to a lot of people who have been hospitalized, for example, I'm sure that they can tell their own stories and anecdotes, and they can also talk about what they were very happy with in the experience and what they weren't so happy with in the experience. Okay, so everybody has their own journey. So these pain points are considered to be a gap, a problem. Okay, so the question is, are all problems the same? Lahat ba ng klase ng problema or gap pare-pareho? And the simple answer is hindi. Hindi pare-pareho lahat ng mga gaps sa healthcare delivery. Dahil meron mga gaps, for example, that we can call are just system improvement problems. System improvement problems. Okay, so maybe if you say something like, it took me so long to get the bill, or maybe I only found out late that this was the amount that I had to pay, or some of the other complaints about their healthcare experience, you can say that that might be part of what we call the system improvement problem. So kung system improvement problem, parang fine-tuning lang yung kailangan gawin doon. So if you're running a hospital, you should be aware of which are the problems that are really the kinds of problems that can be solved by just better management or better execution in the existing healthcare delivery systems. Okay. But I would also argue that, for example, yung rapid increase ng lifestyle disease, okay, and how that contributes, let's say, to mortality rates. Despite the fact that we have all of these healthcare delivery systems around us, and we have all of these different organizations working to create awareness about lifestyle disease, that no matter how well you fine-tune the problem, there's a lot of healthcare issues and problems that will never be solved by the existing system. Okay, meaning the existing system was not designed to solve these problems. So no matter how well you run your system, never na masasolve yung ibang mga healthcare problems. So that's what we call design problems, meaning we have to design something new. We have to design a new service delivery network, for example, so that we can address these problems that persist even though we already have fairly well-run hospitals, clinics, etc. Okay. So what I'm focused on today is really more about the design type problems. Okay. I'm not here really to talk about how to improve the management of existing hospitals. I'm really here to talk more about the bigger problems that are addressed through design or through new startups or through new business models. Okay. So let me just add pala, yung wicked problem, what's the definition of wicked problem? Wicked problem is a kind of problem that is difficult to define, and it's also a kind of problem that cannot be solved by one single solution. Okay, so for example, obesity is a wicked problem. There is no one single solution for obesity. Okay. All right. So we need to apply what we call design thinking. And I think design thinking is appropriate when we have design type problems versus critical thinking, which is the kind of thinking we use when we're doing fine tuning in, let's say, a systems tuning type of problem. Okay. So my guess would be everybody who works in a hospital, to survive long in a hospital, you have to have strong critical thinking. You have to have strong problem solving skills in terms of how do I solve these problems within the context of the hospital system. Okay. So I know that all of you who are here already have that skill, and I'm sure you do that very well. The critical thinking needed to do the tuning type problem solving. Design thinking, though, is different. Design thinking is the thinking necessary to build a new system of healthcare delivery outside of the existing system. Okay. For those of you who like to read about complexity or complexity science, okay, or complex networks, okay, so this is the, if you wanted to learn more about the VUCA world, if you've heard about that, the VUCA world, the nonlinear world, okay, it's rooted in complexity science. And design thinking actually is the thinking approach needed to create new things or new systems within a complex network. Okay. So it combines empathy for the people within the community or within the system, and then creativity to generate new insights and new kinds of solutions, and then a certain kind of economic rationality and technological rationality to actually build the solution. Okay. So for me, design thinkers are, at the same time, they have to have empathy, they have to have a lot of creativity, but at the same time, they have to be very rational people so that they can take all of the insights and then actually build the solution. Okay. So there's a high level of self-awareness needed if you're going to work on a team that's going to create, for example, new healthcare service delivery models. Okay. So the reason why I'm here, and I was telling the organizers, my motivation to speak to all of you is to encourage all of you to consider joining an exercise or an activity that will design new models of healthcare service delivery that are outside of the existing model. Okay. All right. So when we talk about business models, just really quick, what is a business model? It's a blueprint that explains how organizations create value for the customers, deliver it, and capture value. So merong tatlong elemento yon. Create for the customer, deliver by operations, and then capture value for the shareholders. Okay. So it's a blueprint. And, just to give you like an overview of what the objectives of any innovation are, ito po yung tatlong objectives ng lahat ng innovation. It must be desirable. Okay, so people must desire what you create. And it must be technologically and organizationally feasible. Okay, that's why it's important for us to work with the healthcare professionals when designing new healthcare service delivery, because it has to be technologically, technically, organizationally feasible and compliant. And then finally, it has to make money, right? It has to be financially viable. All right. So my understanding is, because of COVID, many hospitals today are actually losing a lot of money. Okay, they're losing a lot of money. Why? Because for many other patients who are non-COVID, hospitals became a not so desirable place to go to. I don't want to go to the hospital. Even the doctors don't want to go to the hospital. And then because of COVID, how the hospital had to operate changed. Okay. So ultimately, the financial viability of the hospitals today are also, I think, stressed or threatened. Okay, and this is a reality. I've had the chance to talk to other people from other hospitals, other managers from other hospitals, executives, and other doctors from other hospitals. And I think more or less I get the same feedback. A lot of the doctors, if they had a chance, they don't want to go to the hospital. And they're worried about how are they going to meet their patients if they don't go to the hospital. The hospital, on the other hand, is worried because a lot of other procedures that could have been revenue generating aren't happening in the hospital because maybe they've been postponed or they're being done somewhere else. Okay. So when we look at the criteria by which we evaluate business models, desirability, feasibility, and financial viability, I would hazard to say, and you can disagree with me, that actually today the current business model of hospitals is threatened. There is a threat against the business model of hospitals today. Okay, so if one of these criteria is not met, the business model is threatened. And that's part of the motivation why we have to reimagine or rethink the business model also of healthcare. Okay, so the ideal really is for the hospital is to find a way to reconfigure the hospital so that the hospital can find itself again in the middle of all of these three criteria. Okay. So I know for a fact that a lot of people over time, fewer and fewer people want to go to the hospital if there's too much friction in the hospital, too many lines, not enough space, and so on and so forth. Okay. So the challenge really for all managers, whether the old model or the new model, is to manage your model into the middle of the three, the intersection of the three circles. Okay. So when we do a startup, so I'll just say this now. When we do a startup, at the beginning, nasa labas po siya ng lahat ng tatlong to. Yun yung challenge ng startup. Okay, so if I wanted to do like a telemedicine startup for Filipino doctors, sa simula, yung startup ko, nasa labas siya nitong tatlong to. I have to figure out a way to design the product to make it desirable. Then I have to figure out an operating model to make it feasible. Then I have to figure out a financial model to make it financially viable. Okay, yun ang trabaho ng startup entrepreneur. Okay, so this is just a quick overview of what the business model canvas looks like. So ito yung pinag-aaralan ng mga estudyante naming mga innovators, mga startup students, lahat ng nagjo-join ng mga competition, yung mga hackathon, etc. This is I would say, the most popular, globally accepted open source framework used to describe a business model. Okay, it's what we call the nine box business model canvas, and this was developed by a professor called Alex Osterwalder. Okay, so it has the customers, it has the value proposition of the business, it has the channels by which customers can access the product or service, it has customer relationships, okay, and then it has a revenue model, so paano siya kumikita. And then on the back end, meron siyang key activities, key processes, key resources. Resources include people, technology, information, data, physical assets, equipment, etc. Meron din siyang mga key partnerships, and then meron siyang cost structure. Okay. So if you went to school and you wanted to study something like innovation management or startups, this is the framework that we would use to describe all of the startups that you are ideating or brainstorming about. Okay, so this is called the business model canvas. So pwede akong gumawa ng ganito para dun sa mga existing na hospitals. And pwede nating i-evaluate yon dun sa tatlong criteria ng desirability, feasibility, and viability. And kung totoo nga na threatened yung financial viability ng hospitals, we have to find a way to change something here so that the hospitals can maybe recover and be a little easier to manage moving forward. Okay. So this is business model canvas. Now, for all, when we talk about digital transformation, of course, there are a lot of business model names that we use to describe different types of possible business models. Okay, so like subscription model is the model of Netflix. Okay. Freemium model is the model of Spotify. Di ba sa simula, libre siya, pero kung gusto mo yung full features, magbabayad ka. Free model is like Facebook. Di ba? We use Facebook, all the products and services of Facebook. We never pay. Okay. But they take our data and then they sell it to somebody else. Okay. There's marketplace model like Lazada and Amazon. Okay. There's access over ownership model. The example here is like Grab or Airbnb. Experience model, selling products and services that offer a superior experience to users at a higher price point. So like Apple, Tesla. And then aggregator ecosystem model, grouping together, connecting interdependent suite of products and services in an environment that subsequently increases value as more is purchased. My example here is like App Store or Google Play Store. Tapos nandun naka-aggregate lahat ng mga apps. Okay. So these are all examples of digital business models. And the reason why I showed this is the truth is in the future at some point they will come to the healthcare service business model, okay? So sa healthcare delivery, dalawa lang ang kumbaga dalawa lang yung sides na pwede niyong pagpilian. Kumbaga kung evolution ito, if you say healthcare delivery is undergoing some kind of transformation or evolution, there's only two sides to choose. Which side do you want to join? Okay. So either the side you will join is you will be part of the digital transformation of existing traditional analog based hospitals and then converting them from analog manual to digitized. Okay. So this is literally converting the existing hospitals and making them do either business process improvement or product service innovation. Or some of you will be part of groups that will build digitally native startups. Meaning, startup siya na from the very beginning, from its inception, naka-build na siya based on known digital platforms already. Okay. Um, so there is a huge market for the digital transformation of hospitals. There's so many suppliers, there's so many companies, there's so many consultants, so many training providers that are very, very, very interested to provide support to hospital administrators and to hospital teams and staff to help them adopt new technologies in the operation of the existing hospitals. So I've been part of that for some companies. But today my talk really is more about these digitally native startups. Okay. And then maybe trying to tickle your imagination and see whether some of you might want to actually start up a new company in this space, which is digital from the very beginning. Okay, if it's digital from the very beginning, you can already skip the whole transformation part. Okay, inom lang po ako ng tubig sandali. Okay, so let's look at some examples of digitally native healthcare startups, okay? So here's a vision of the future. So one example. So this is basically the disaggregation of hospitals. So I'm a big believer that hospitals today are too complex. It's too complicated. There's too many types of patients, too many types of specialties or practices within the hospital. And there's a real opportunity to improve the service delivery of some of the specialties by disaggregating it from the bigger hospital. Okay, so there will be some that will be left in the hospital. So notice here on the left side, it says hospitals to focus on complex care. But many of the other practices might actually be brought outside into some virtual, interconnected network of service delivery facilities or nodes. Okay. One big aspect is hospital at home. Okay. So let me just say, if you like Apple and if you watch the launch of the Apple Watch last September 15, Apple Watch is clearly being positioned as a medical wearable device. Okay, pwede niyong balikan yung video ni Apple launch ng Apple Watch 6, Series 6. And the whole positioning of the Apple Watch is about everything about prevention and monitoring and measuring. Okay. In fact, they talk about ECG, They talk about falls. They talk about blood oxygen. I'm sure in the future, as the sensors become more sophisticated, they're probably going to go into the areas of blood sugar, blood chemistry, and so on and so forth. Okay. So a lot of the treatment will be done at home, hospital at home. And then there are going to be primary care specialists. So there's going to be a whole reimagination of what primary care is supposed to do. Decentralized community-based providers. And then here on top, common technology platform, centralized telemedicine doctors and nurses. Okay. So I'm going to say it. It's not meant to be mean or anything. But what this circle in the middle means is that there's going to be like a grab like type of experience when it comes to doctors and nurses. I will be able to look for doctors and nurses as if I was looking for a grab. Okay. That's going to happen in the future. So there was a presentation done by this venture capitalist company. It's called Anderson Horowitz. It was a very recent study, August 2020. And it talks about 5 changes that will happen that was expected to happen 10 years from now, but will probably happen in the next 3 years. Okay, so I just wanted to emphasize this point, no? That there's an acceleration. The rate of change in healthcare is speeding up for many reasons. One of the biggest reasons is in the United States, the cost of healthcare is so high that everybody is forcing some kind of innovation to break the cost structure of the existing healthcare system in the US. What's going to happen is all of those technologies that will be built to solve all of these healthcare problems in the US will be available for the rest of the world. And that's what's going to push the adoption of these also in Asia and in the Philippines. Okay, so here are the different trends. No? Unbundling of hospital, moving towards virtual care. Move to value-based payments. So what does this mean? Today, ang payment natin is based on activity-based payments. Right? All of other insurance providers, whether private or public insurance, they pay based on activity. In the future, the payment will be based on values or outcomes. Okay, so magiging iba yung basihan, meaning the quality and the outcome of the activity will matter more in the future because the financial payments will be based on outcomes. Magkakaroon ng direct-to-consumer as a viable go-to-market strategy. Okay. So this has an impact on pharmaceutical companies, medical equipment companies, and medical service providers. Recontouring of provider networks and interoperability and automation. Okay, ito yung medyo mabigat intindihin pero ito yung pinaka-significant actually, yung interoperability. It looks like, honestly, it took decades before electronic medical records became an idea that was even worth considering in the Philippines. My guess is that as most of our personal data is already moving online already, that most likely EMRs will become more and more acceptable. And once these EMRs become more acceptable, the big challenge will be how can we interconnect and interoperate around common EMR records. Okay. So yung interoperability and automation. So here is a diagram showing the top 150 startups in the digital health domain. Okay. You can have a copy of this. For those of you who are interested, I think what you should really look at here are the categories. Ano-ano yung mga categories ng mga startups na meron. So, gusto ko, basahin ko lang muna yung mga categories. Yung mga brand names, siguro, if you're really interested, research more on the individual brand names. But I think what's critical here are the categories that are under development. Administrative automation and digitization, disease management and therapeutics, screening and diagnostics, drug discovery, clinical trials, clinical intelligence and enablement. What's this one? Sorry. Primary and urgent care, specialty care, pharma supply chain, health plans and benefit management, real world evidence, and virtual care delivery. Okay. And there's a summary slide here showing the breakdown, how much percent of the startups belong to which category. Okay, so you can see actually that there's a lot of coverage already in the whole service delivery process. Marami na hong nako-cover ng mga digital startups. Okay. And in terms of telemedicine, okay, so if you're interested to know, when it comes to telemedicine, ito yung pinaka-popular na categories under telemedicine. Okay. So most popular, of course, this is August 2020. So most popular, of course, is telemedicine platforms. Okay. 27% is remote monitoring and diagnostics. Okay. So I don't know about you, but personally, I use an Apple Watch. I just started using an Apple Watch this January. And I promise my whole behavior has changed when since I started using the Apple Watch. My level of physical activity and exercise has almost quadrupled this year compared to last year. Okay. And if somebody asked me today if I would be willing to share the data from my watch to my doctor, I would say yes, for sure. And if somebody asked me if I was willing to share my data to my insurance company in exchange for a cheaper premium, I would say definitely yes, for sure. Okay. So, ano na to, habang, at nakikita nyo yung sa Apple kasi, ang importante kasi si Apple, binababaan pa niya yung presyo ng mga Apple Watch. So, the Apple Watches are becoming more and more affordable. I think the cheapest Apple Watch as of today, I think, an older generation Apple Watch is about $199. Okay. And then we have other platforms here. Okay, so therapy and coaching, lalo na sa mental health. Okay, 18%. Virtual and primary care, 11%. Telepharmacy and RX subscription, 6%. And then virtual assistants. I think these virtual assistants are more for the doctors, 6%. Okay, now here's a slide just showing really quick this idea of unbundling primary care. Okay, and you'll notice that dito sa kaliwa, sa demographics, talagang hiniwalay na nila yung bawat demographic from pediatrics to general adult, women, men. Of course, we should add other genders here as well, no? Because I think there are certain emerging issues about other genders. Senior care and low-income care. Okay, and then they also classify it by level of care required. And it's already beginning to show how different business models are emerging within this space. Okay. So, of course, this is critical to understand because the people who will operate in this space will definitely have a different training or a different kind of background from those who work in the hospital. Okay. So, I don't know whether this is going to actually increase the need for professionals. And if it will, the question is, can we have professionals but with a different learning or educational background? Okay. All right. So just a few more slides. So the disruption is happening on both sides, both supply and demand. In short, bumibigay na parehong side. So there's a need to relieve the system by considering all of these new startups. I'm showing this to you. I'm actually more interested in the next slide. But ang point nito is there are very specialized startups that are doing very specialized tasks within the healthcare system. So yung iba, taga-access lang. Appointment, primary care, virtual care. So the one that I'm using is Zenia. I don't know, the local version, the one that I'm using is Zenia, where you can order diagnostics, you can access a doctor's appointment, you can get a COVID test using the app. Now it's called Zenia. I'm sure Ayala has their own, and I'm sure there are other apps that are providing access to these basic services. And then we have healthcare payments, okay, which will be the domain of the insurance companies. And then ito yung Zenia, yung care delivery experience. Okay. So we have startups that are specialized, but what I wanted to show actually is the next one, which is they will be specialized in what we call full stack. So itong general primary care, chronic disease, senior care, and women's health, in my opinion, these are examples of practices that will probably be considered na i-disaggregate dun sa traditional na hospital model. Okay. So here are some examples of some companies. So if you're interested, for example, if you're interested in women's health, you can search TIA. So the name of the startup is TIA. And then you can get a flavor of like how their service experience is like. Focus on women healthcare across these three different functions. Okay. So ito yung tinatawag natin na full stack. Na pag inalis yan dun sa hospital, it's going to be the full customer journey that's going to be pulled out from the hospital. Okay. On data naman, notice this statement here, no? The center of gravity of data is shifting. We're at the tipping point where data generated outside of the traditional acute care setting will be more valuable than the data generated inside the acute care setting. What it means is that the data generated before I become a patient is more important than the data that you generate when I'm a patient inside your hospital. Okay. And the value of that data, I think, I can imagine, no, from the insurance company's point of view, the value of that data is very high because technically, if they can spot early cases and they can avoid those cases, then the insurance companies will save a lot of money. Okay, and that's why the value of that data is becoming higher and higher all the time. Okay, so this is what they're hoping for. This is the objective of all of the entrepreneurs, the digital entrepreneurs in the healthcare space. So the data scientists, the IT experts working with medical practitioners, this is their objective. A cheaper healthcare system without sacrificing quality. And do you want to know what the secret sauce is? What is their secret? Ito sa ilalim. They will move away from a mindset of intuition to one of engineering that leads to efficiency and scalability. Now, what does that mean? In the future, they will rely less on the individual intuition of doctors, meaning they will reduce the reliance of the healthcare delivery on individual doctors' expertise. And they will rely more on the collective insights gained by analyzing data captured from many different patients treated for a particular condition across many different facilities. And then using that to create some kind of expert system that will assist the treatment of future patients. Okay. Now, again, if you ask me as an outsider, I like this because there are so many people who cannot access healthcare. But as somebody who is here for you today, I know and I have empathy that actually this has a direct impact on you. Okay. And this might actually offend some of you. So I recognize that. Okay. But we just need to understand the logic behind why these innovations are being undertaken. Okay. So for those of you, if you want to go deeper, there's really a need for a new operating system for care delivery. Okay. So ang mauna dapat yung system of records. Okay. So I know for a long time that PhilHealth, along with many startups and hospitals, we're trying to develop certain protocols and standards for electronic medical records and try to align that with the payment processes. So I have been personally involved with several startups that were in the EMR space. Siguro at least 4 or 5 startups in the EMR space. Okay. So my gut feel is that it hasn't really progressed that far. Okay. But the ideal really is to have a system of record. Okay. Pero ang gusto nang mangyari para bumaba yung presyo is system of interoperability. Meaning any doctor anywhere technically can access my EMR, or I can send my EMR record to any doctor anywhere. So for example, if I'm living here in Quezon City, but I find that the best value for money doctor for my kind of disease is a doctor who's practicing in Olongapo City, then I'm going to contact that doctor and send my medical record to you and say, Doc, dyan ako magpapagamot sa Olongapo kasi feeling ko your track record there is as good as the doctors here, but you're cheaper than the doctors here. So I need to be able to transfer my records to you there in Olongapo. Okay, so this is what interoperability means, that patients will have the freedom to find the right care delivery provider based on their quality requirements and based on the capacity to pay. Okay. And then finally, ito yung sa kanan, ito yung magiging systems para sa mga doktor. How can they have tools that will help personalize task automation and triage automation? And how can doctors continuously monitor and interact with their patients, even virtually? Okay. So ito yung parang high-level architecture ng mga systems for the new operating system for care delivery in the future. Okay, so I think this is my last slide or second to the last slide. But in terms of no die patient in the future, hindi mo na sila, kumbaga hindi na sila magiging bago. In the future, technically, magkakaroon kayo ng access sa database ng lahat ng mga tao. And there's going to be a system by which patients and doctors can be connected and where the doctors can provide personalized care and personalized service. Okay. So, and then finally, ito yung kinikwento ko kanina. So like in the US, magkakaroon ng matching ng demand and supply outside of the normal markets. Okay. So halimbawa, yun nga, kung halimbawa taga Quezon City ako, pwede ako maghanap ng provider or supplier in other parts of the country depending on how I feel the match is. Okay. So pag naging mas transparent yung supply, mas magiging madali para sa mga pasyente maghanap ng mga providers somewhere else. Okay. So on that note, I'll end there. I can share this presentation with you. Actually, what happened was I put extra slides after. Parang ano to, parang sa Avengers, di ba? Parang merong post-credit. So if you still wanted to study pa some of the slides, meron pa mga slides dun sa mga masisipag na wala masyadong, hindi busy during medical week. Meron pa mga slides after. But technically, my presentation ends here. Okay, Doc, thank you so much, everybody.
Thank you so much, Professor Richard Cruz, for that engaging and insightful lecture. And I am amazed by the concepts you introduced to us. And I'm just worried about the sector, the indigent patients we have who are not well educated and not able to cope with the digital transformation and are not even able to buy cell phones or access mobile apps or softwares. How can we bridge that gap? How can we provide healthcare for these people?
Okay, so this is a question about the penetration of the digital devices, right, and internet connection to the rest of the population. So I will say that just to give some information about the profile of internet usage in the Philippines. I think right now the penetration rate is somewhere around 80% of the population has access to device, and there's a good number who actually have multiple devices. But that number was before the pandemic. Okay, so but because of study from home and work from home, ang feeling ko is medyo nag-increase lalo yung digital penetration rate to more families. But of course, there's still a percentage that's still not covered. Okay, but let me just say, for those that are covered, those who have digital devices, alam niyo po ba na ang Philippines ay number 1 sa mundo in terms of how many hours a day is spent online? We are number 1. On the average, we spend 9 hours and 45 minutes a day online. And we are also number 1 in the world when it comes to amount of time spent on social media. Okay, Filipinos who use digital devices are spending almost 4 hours on social media every day. Okay, so I will say that yes, we need to figure out how to provide that affordable and accessible healthcare to those who don't have access to digital, and they will probably be the primary target of the public healthcare system. But for those who are in the private system, the private healthcare system, I will just say that the market for your market in the private sector, the private system, is very deep and very young and very digital. Okay, hindi ko alam kung familiar kayo sa demographics ng Philippines, but our median age is 24. We are the fifth youngest country in the world. We are the youngest country yata in ASEAN. And 1/3 of our population is below 14. At the same time, we have a record high number of senior citizens. About 10 million of our population is above 65, and that's the highest percentage ever in the history of the Philippines. Okay, so we're really bursting on both sides of the demographic scale, both on the senior side and on the youth side. We're really bursting. So I would say that those issues of connectivity, eventually they will be solved. The objective actually under SDG is 100% adoption of internet access. So, and that should technically, the internet accessibility under the SDG should happen 5 years before the rest of the SDGs become due, because the internet connection is a prerequisite before we can solve the other SDG problems. Okay, so I agree. Right now, it's not yet there, but it's a lot better than it was like even just a few months ago.
Yeah, I agree. I agree, Prof. And in fact, hindi lang sa patients yun, even us doctors, some of us, especially those belonging to the older age group, sorry po, no, it's a challenge for them, you know. Even my parents, I am teaching them, no, yung, it takes time, no, and yun yung mga nakikita ko na magiging natin future challenges that we need to overcome. But like you said, this is inevitable. It's gonna happen.
I fully expect that there will be a new set of digital devices specifically designed for senior citizens coming out, because I
Yung mas-
already see it in development with some. Yes.
That's correct.
Yes. Pero smartphone na siya, hindi na siya parang Nokia na 3210. Ano na talaga siya? Smartphone na merong operating system, pwede mag-download ng app, etc. So this is, in a way, this is the silver lining behind COVID. The silver lining behind COVID, really, it pushed all of our systems into almost collapse. And it really forced the hand of many institutions to digitize. Okay, so literally nakatipid tayo ng mga 7 to 10 years worth of waiting for the change to happen. It's already here on our doorstep.
Yes, that's correct. There's one question here from Dr. Solomon Hakalne. In how many years do you think AI will appear in the healthcare system in the Philippines?
Well, AI needs data. So the algorithms are already there. So the challenge lang is to convince people to share their data. Okay. Whether it's going to be part of insurance, EMR, and data sharing, and let's say a reduced policy. I know Manulife was trying to do that. Manulife was convincing me to wear a health band in exchange for a lower policy premium. So, ano lang po yun? Kung, sabihin ko na lang ganito, almost all Filipinos use Facebook, and we are sharing so much information on Facebook for free.
Yes.
If somebody comes out with a business model that says, share with me all of your posts and the data from your wearable, and you can get cheaper healthcare, I'm sure people will share their data. Okay, so it can be very fast actually. So let me just reiterate, the algorithms and the technology is already there. What's missing is the data. Nobody has created the business model to capture the data yet, but there are existing business models that already capture a lot of data, like social media, like Facebook, like TikTok.
Yeah.
Okay. So is it possible within the next several years? Sure. Very possible. And again, I watch Apple very closely because kung pinapanood niyo yung mga product launch ni Apple, palakas ng palakas yung positioning ng mga products niya sa healthcare. That's why I know it's coming soon. Okay, sorry about that.
Thank you, Prof. And another question from Dr. Arturo Mendoza. Very nice lecture. Worrisome in some aspect, like the tendency to shift to relying on engineering rather on the intuition of doctors. That's the future holy grail of the future healthcare. What will happen to specialization? Does this mean that the computer or machines will do everything?
No, but I think it's hard to say, Doc. I'll be honest with you. It's not transparent. I cannot see it. How do we really measure the quality of the service that are delivered by healthcare workers? And I ask that as a person who is concerned about people getting quality healthcare. Okay. So there's a hypothesis because of the lack of transparency. There's a hypothesis actually that there are a lot of service delivery problems in healthcare. And part of the belief is that much as there are many doctors who are trustworthy and that we should rely on their intuition, that there are also many other doctors who maybe over the years has not been able to maybe deliver service at a certain level. Okay, so I say that with full respect, but just the reality that hindi ko kasi po alam sa inyo eh. Sa amin kasi sa education, we get evaluated left and right. Bawat movement namin na-evaluate ho kami. And all of our evaluations are posted. Students can see the evaluation of the professors. Our evaluations are reviewed several times a year. So it's relatively easy for a school administrator to find out if a professor is not delivering the service for the students. Mabilis siya. Saka yung mga parents mabilis din magsumbong. Okay. I don't know how it works exactly when it comes to, let's say, doctors and healthcare professionals. And I know that that's a sensitive subject, so I don't want to delve into it too much. But I think the reality is that there are people who need the service and there are people paying for the service. And both of those stakeholders are always going to demand for better quality service at a lower price.
Yeah. He added in his question, does this mean the computer or machines will do everything in terms of diagnosis and treatment, making medical care less personal? But yes, that's the future. So he agrees with you in that. And then another question, start of change will be from education of medical students. It is starting now since technology is coming. Can we, in training residents and medical students, do something to go with how the future is shaping?
Yeah, I think, to be honest, I think medical schools should also behave like technology schools. So, yung pagiging cross-functional niya, so yung intersection ng biology sa mathematics in the context of digital technology, I think it has to be strong. I have a lot of classmates from Philippine Science. I know, Doc, you're also from Philippine Science, but I have classmates who are working in the pharma industry in Philippine Science. They're working in Pfizer. They're actually involved on, some of the vaccine research. And they shared with us the amount of big data analysis that they're using to test all of the possible combinations in the formulation of the vaccine. And they were telling us that they've saved years of research because of the big data analysis that are being used on proving that the drugs and the vaccines are effective. Okay. So it seems to be going that way actually. So even for myself, right? In my space of business and marketing, data analytics is already invading us left and right. So the reality is, for some of us, the nice thing is that data analytics is also becoming a simpler tool to use. Hindi na siya kasing complicated. Pero nandyan na po siya. In fact, if I were to tell you here, if any of you plan to build a new clinic or a new hospital anytime soon, I hope you build it digital from the very beginning. Huwag niyo na ho gayahin yung lumang modelo. Diba? Pag magtatayo kayo ng clinic ngayon, kahit maliit na clinic, sana ipapanganak siya, digital na siya, hindi na siya analog.
That's right.
Diba?
Mm-hmm. Thank you, Dr. Ortin, for that question. And another comment here from Dr. Leah Pulmana. It's really time for us to rewire our brains and adapt to changing times. If you have any more questions, you can just type in the chat box. And while waiting for the question, Doc, regarding yung disaggregation of hospitals, I like what you said kanina with your slide. Kasi right now, we get patients who come in the clinic who need highly specialized or specific diagnostic tests, which are not available in small laboratories or clinics, and they're only available in big hospitals, not even in government hospitals. Talagang yung mga malalaki lang. And this is one problem that we deal with now because the patient needs the test, but they don't want to go to the hospital for fear of getting infected, etc. Delay in the results, ang dami. So it would be nice, nakuha ko yung point mo kanina that, you know, na meron silang pupuntahan na separate from the hospital or at least, you know, siguro separate building or I don't know, that mawawala yung fear nila na they would have to go to the hospital and kasama nila yung mga inpatients na dadalhin doon na ipa-prioritize, they will have to wait long lines and then the results come, you know, hindi timely or whatever. So, plus maybe more expensive. So, I don't know. Pero yun yung point mo that you explained quite well. And may mga labs na nag-o-offer ng home service, meaning they would do blood extraction. They would go to your home for an added fee, and then they will just email the results. So, we get consults and queries kasi may mga like in here in Olongapo in the Freeport may mga residents dito na mga foreigners, no, mga retirees, and they want that that service. However, it's not common, no, and not all labs or hospitals offer that, pero they are willing, very much willing to pay that added cost for convenience, no?
But Doc, remember, if you do telemedicine, I can be in Quezon City and consult with you in Olongapo,
Yes.
right? And the reality is, one of the biggest reasons why I will consult with you based on the survey is because it's not difficult to set an appointment. One of the biggest reasons why people don't want to consult is because they find it very unreasonable, the hurdles that they have to overcome just to get an appointment with the doctor. So parang kung if you don't want to have an appointment with me, edi no, di ba? So I guess what I'm trying to say is in the same manner, AIM can hire a professor from Mexico tomorrow and start teaching classes tomorrow also at AIM, never having to leave his house in Mexico. Okay? And in the same manner, yun nga, kung nagiging available na yung mga doctors sa Olongapo for telemedicine, technically, pwede na kayong tumanggap ng pasyente galing sa ibang lugar kahit malayo. So for some of you, actually, that might actually increase the number of consults you have because the way you design your telemedicine experience is more convenient compared to, let's say, the doctors who might be closer to me physically, but they refuse to have a digital connection to me. So kahit malapit sila, I'm actually going to spend more time, let's say, going to St. Luke's, Quezon City from my house than it would be to schedule an appointment with my doctor who's based in Olongapo City. That's why reviews are important. Kasi kung mababasa ko yung review ng doktor na taga Olongapo at sasabihin ko, aba, yung experience niya sa kanyang level of performance niya dun sa field niya is ka-level na ng doktor ko dito sa St. Luke's. Bakit pa ako pipila dito physically if I can already access that doctor through telemedicine in Olongapo? That's why there's a need for transparency so that I can make that choice.
That's right.
So I encourage you to experiment with it. Baka for all we know, baka makaganda pa. 'Di ba? So instead na katakutan siya, baka for some of you, baka ikagaganda pa ng practice ninyo yung paggamit ng telemedicine or yung online diagnostics, etc.
That's right. Can you comment on this, Prof, from Dr. Mendoza again? If this trend of the future will send the message that difficult residency training may be a thing of the past, as the computer and machines will do it all. So as you know, bago po kami maging specialists, we have to undergo residency training program, no? And with that in mind, yung future of healthcare, how do you see this change the training program?
I think that parang YouTube din lang yan. Ang analogy ko, YouTube. Kung magaling kayong doktor, your market will be so huge and your market value will be so huge. Meaning if your motivation was financial, the digital platform will allow you to monetize your skills in a so much bigger way. Para magiging YouTube sensation kayo kasi anybody and everybody will have access to you. Okay. I think what's important here though is that ang ginagawa nito mga innovation nito is it allows people who are less talented to find their level within the overall healthcare system. So for example, when you say reimagine primary care, I'm assuming that maybe the requirements of some of those primary care services are less compared to like if you had to work in the hospital in the more specialized care. So, not everybody kasi can be that specialized. So I guess what I'm trying to say is that baka in the future yung pathway nung specialized will really be different, right? So I don't know exactly when we say difficult residency, whether this applies to all the doctors, including GPs, or whether this residency is more focused on specialized. If it's focused on specialized, I don't see the difficult residency going away. It's still gonna be there. Okay. But yun nga, parang siguro, we have this term overserved. Overserved. Meaning, how many times do you guys treat a patient where your expertise is way too much compared to the disease that you're treating? Diba? So parang mali din yun, diba? Kung ang doktor na pinuntahan ko, sobrang taas ng expertise level niya compared dun sa sakit ko. It's a waste of the doctor's time. The doctor should have been treating somebody who has a more severe or acute disease. Diba? Nasayang yung oras ng doktor dun sa akin kung kaya pala akong i-treat ng mas lower qualified na tao na mas mura din sana sa akin. Okay. And I think that problem happens also that we're actually paying too much because ang term is we're being overserved by some. Okay. So we're trying to avoid being overserved and we're also trying to avoid being underserved naman. Na there are people naman who are being treated by doctors who are not qualified enough to treat the actual disease that they have. So we're trying to find a way to match the right expertise to the right case para laging tama lang yung treatment. Hindi too much, hindi too cold.
Yeah, I agree. I agree, Prof. The residency training program will still be there, but maybe there will be different approaches and integration ng, augmented reality and mga high-tech revolutionary techniques, no? And
Saka, di ba yung mga drug design? Alam ko ang trend sa drugs and I didn't go into it because that's really not something I can talk about intelligently. But my understanding is a lot of the drugs now are being designed at the DNA level. And there's going to be a need for doctors to know how to program those drugs, so to speak.
yes, that's correct. And from Dr. Jaime Rojo, how far away are we in the Philippines from using wearables in healthcare?
I'm already sold, Doc. I'm the wrong person to ask because I'm already sold on the idea of wearables for healthcare. Honestly, so this is my Apple Watch. Okay. It has completely changed my behavior and I wear it almost 24 hours a day. So it's practically collecting all of my information. And I have a ton of information. I think, again, no, if the hospitals can find a way to use data that will make your lives easier, diba? If it will make care easier and cheaper and more effective, then there's a motivation for people to pay for that. So we just have to find that model where. So the problem is not the wearable. The problem is what are you gonna do with the data that the wearable collects? Sino mag-analyze nun? Sinong gagamit nun? So who's gonna make some kind of healthcare service that's really based on, let's say, the constant monitoring of my. So what does my Apple Watch monitor? My heartbeat, my heart rate of variability. Technically now it can monitor my blood oxygen, and so on and so forth, right? My exercise levels, etc. So if I complement that with other diagnostic tools like blood chemistry, etc., I think you can get a better picture, and technically, I can get better healthcare.
Mhm.
Okay. And then it's gonna connect to pharma, but also to food in the future also.
Yes. Is that in place already in US, Europe?
Uh, Actually, in the US, there are a lot of employers who make the investment kasi nakakatipid yung employer. So yung employer yung may motivation para gumamit ng wearables yung mga empleyado nila. Kasi yung employer ang nakakatipid dun sa healthcare costs. Kaya maraming companies sa US are mas proactive when they spend on healthy eating or exercise or wearables, change the behavior. Kasi the cost is real sa kanila pag nagkasakit yung mga empleyado nila. Mahal talaga yung healthcare insurance premium na babayaran nila pag yung mga empleyado nila na hospital talaga sa US. So there's a real strong motivation for them to save.
That's good.
Dito, tingin ko dito it's the same. It's just that we don't have the right business model yet.
Mhm.
But
Another
that's why I'm showing you the 150 startups, diba? Kasi one of those will figure it out and then they will be the one knocking on your hospital door selling you the solution.
Oo nga, Prof, nagulat ako. Ang dami na pala.
Marami na, marami na.
Yeah. So another question from Dr. Tess Ortian. Would data privacy not be a question on this era of openness to medical data?
It's going to be even more important. That's why the timing of the Data Privacy Act is crucial. And if you look at the surveys among yung sa mga IT services, the number one IT service in demand right now is data security, data privacy. Kasi they know that without data privacy, data security, people won't share the data. So, but we're there. I mean, just being honest, no? For all of you who use Facebook, I'm sure you already share a lot of data on Facebook. So it's not like people are really super conscious about their data privacy all the time. Okay, so I don't know about their healthcare data because I'm sure a lot of people post about their illnesses on Facebook also. So it's not like they keep it secret naman na may sakit sila or something. So yeah, but for sure it's very important.
Thank you, Prof. And another question from Dr. Joanna de la Cruz. This pandemic has presented both opportunity and risk. As a mental health professional, I have used Doxy for telemed and I get a mix of all economic sector society. And I agree with the good professor that Pinoys everywhere uses the internet a lot and this innovations in healthcare is good. Also, it's a good input pala.
Siguro
Thank you.
dapat maghanap kayo ng supplier na magbibigay ng discount sa lahat ng doktor na magpapatayo sila para mini studio / clinic sa loob ng bahay nila para maganda yung audio-visual layout nila para ano rin, enjoyable din yung mag-telemedicine sa bahay.
Mhm.
Hmm.
Okay, another question. The latest wearables are smart glasses specifically for the surgical field, but tech is primitive pa rin. They foresee patient data popping the screen on voice command. They can even be used in training. And from Dr. Leah Pulmano, major changes will happen starting from the medical schools, then training, and eventually medical practice. Such a big challenge. Ayan po ang comment niya. Prof, which hospitals in the Philippines have already started adapting or making digital transformation, and yung parang sino sa mga hospitals natin dito are setting the bar or, for providing optimal healthcare na medyo futuristic na?
Sige. So, offhand, I would say, of course, St. Luke's Global, technology-wise, medical technology and process technology-wise, medyo high-tech siya. But just to share with you my inside conversation with them, they might be high-tech right now, but the challenge really is that marami silang kalaban na mas mura. Okay, they have a lot of competition that is a lot cheaper than St. Luke's Global. So in a way, even though they have digitally transformed, the cost is still high. So my point is that we do a lot of this adoption of technology at hindi dapat na parang nagiging premium yung service lalo, di ba? Hindi yung napapamahal lalo. Dapat, in a way, maybe for some, mas mahal. But the overall impact should be some of the services should become more affordable and better quality. That's the holy grail, right? The holy grail is better quality and lower cost. I think St. Luke's got the better quality part, but they didn't get the lower cost part. And that's why they have it, but actually the utilization of St. Luke's Global is quite low. And if you talk to anybody there, they'll say that their population, their census is quite low, even though they have the best technology. And medyo na-misread yata nila yung willingness ng mga tao to pay that premium for the technology. Okay. I don't know
Competition.
about you, but my health insurance just gives St. Luke's Global as an optional. If you want to have coverage in St. Luke's Global, I have to pay extra. Meaning my insurance company won't even include St. Luke's as part of the normal hospital coverage for my insurance policy. Pero St. Luke's Quezon City kasali. Okay. Pero St. Luke's Global, ano yun, parang extra rice yun. You have to pay extra.
All right. Thank you so much, Professor Richard Cruz, for that very engaging discussion. No? Na medyo natinag niyo po ang aming mga kaisipan.
Can I just ask the doctors to maybe put in the chat how they feel right now? Just to give me some feedback about the tone that I took in the presentation. Baka they can just give me some direct feedback about their thoughts or feelings. Mga 3 words or 4 words, just so that I can get a sense of because it's hard for me to I don't see everybody on the screen, which is okay lang. But maybe if I can just get some feedback about how you feel about this conversation. It could be negative, it could be positive. At least any feedback is good feedback. Sige. So para may assignment muna yung mga students na please put 3 or 4 words of feedback in the chat. Thank you, Cora. So as you're typing into the chat, if I can just say my parting words. There are so many young, talented innovators in the digital space. Okay. Maraming may intention na mag-innovate within the healthcare space. Pero medyo hirap lang sila maghanap ng mga collaborators na galing sa health sciences side. And I honestly believe, having met all of you here and many other doctors before, and knowing all of the great young innovators we have in the digital space, I honestly believe that we're kind of underperforming our full potential as a society to innovate healthcare. So ang suggestion ko lang or ang reaction ko lang is maybe be more open to have conversations with outside of your tribe, especially those in IT, etc. And help them see what's happening inside your tribe also. So I know how hard you guys work and how dedicated you are to your profession. And it would be my hope nga that kasali kayo dun sa transformation ng hair industry. Hindi lang kasali, na talagang kayo yung magli-lead sana. Okay. So thank you for all of the feedback. I will save it on my laptop before I exit later. Yes.
Thank you so much, Professor Richard Cruz. And for me, my personal feeling, na one thing that I remember, we are the only ones limiting our own potential. So maybe if there's one thing that I would remember from your talk, that's it. No, we have to really embrace change and integrate with other specialists or IT and other engineers that will help us optimize healthcare delivery. Thank you so much again. We are very honored to have you with us tonight.
Thank you, and God bless all of you, and thank you for all of your service and hard work. Salamat po.
Before we leave, can we just award our certificate, a virtual certificate of appreciation to Professor Richard Cruz for being our guest speaker for the topic, The Future of Healthcare, as part of the Medicine Week celebration, given this 22nd of September, during the virtual Zoom webinar, signed by Dr. Paulo Villarreal, our secretary, yours truly as the chairman of Medicine Week, and our president, Dr. David Calapatia. Thank you so much, Professor Cruz. It was very enlightening, very nitpicking of the brain, imagining what the future holds for us. And likewise, we would like to also award this certificate of appreciation to Dr. Asean Briones Del Mendo for moderating the future of healthcare as part of the Medicine Week celebration. Thank you, Dr. Briones Del Mendo. And before that, before the closing remarks, I would like to, there was a secret raffle. Okay. Secret raffle by Dr. Villarreal and Dr. Roldan. So we have 3 GCs from Extremely Espresso. So first winner is Dr. Crescencio Gonzalez. Second winner is Dr. Jaime Rojo. And for our grand prize winner is Dr. Tony De La Cruz. So you may message Dr. Villarreal or Dr. Roldan where you want the gift check to be delivered. Hindi pwedeng virtual yung gift check, kailangan i-deliver. Okay? So with that, thank you very much for attending this very interesting off-topic, off-COVID Professor Richard Cruz. And again, a reminder for tomorrow's activity. We would like to invite you for another lay fora about preventing and controlling COVID-19 at the workplace. This will be, our speaker will be Dr. Albert Domingo. This is going to be from 1 to 3 p.m. tomorrow. And again, reminder, for the costumes, please send your entries to the ocmsofficial@gmail.com. Deadline for tomorrow, prizes will await the winners. So with that, thank you again, Professor Cruz. It was a very delightful, challenging, what else are the descriptions? Challenging, hopeful, overwhelming task ahead for the future. Thank you for opening our eyes to this. And again, to all the participants, thank you for participating, attending, and for your kind attention. See you all tomorrow. Professor Cruz, baka mag-usap pa tayo.
Photo ops daw, photo ops.
Okay, photo ops.
Who will take the picture?
Opo.
Okay.
Video po, onyo.
On video.
Turn on your video.
Okay, 1, 2, 3. Next page. 1, 2, 3. Next page. 1, 2, 3. Next page. Turn on your video, please. Turn on. Turn on your video, please. Anthony De La Cruz. Okay, we're done. Thank you. Thank you, everyone, and have a good evening.
Thank you. Good night, everybody.
Thank you.
Hi, Prof. Thank you for your time. Thank you.
Salamat
Thank you,
po.
bro.
Thank you.
Thank you,
See you
bro.
tomorrow.